To build a future together as one network, it's important for us to have some grounding in where we started. Our story begins with the Sisters of St. Joseph, women who dedicated their lives to treating the sick and the poor in Toronto. My name is Beth Johnson, and I'm the Executive Director of Mission Integration for Providence Healthcare, St. Joseph's Health Centre, and St. Michael's Hospital. In 1650, 6 women came together in Le Puy, France, and formed the Sisters of St. Joseph. They experienced a call to work with the poor and the sick, and they wanted to be one with the dear neighbor. From that simple mission blossomed a legacy of care across the globe.
In 1851, 4 Sisters of St. Joseph, including our foundress, Mother Delphine Fontbonne, arrived in Toronto to run an orphanage on Jarvis Street. With typhus and cholera decimating the poorest in our city, the sisters expanded their work to also serve the sick poor and those who had nowhere else to turn. My name is Sister Marianne McCarthy, and I'm a member of the leadership team of the Sisters of St. Joseph of Toronto. In 1855, Toronto's Bishop de Charbonnel wrote a letter to the diocese announcing that a House of Providence would be built. It would be a place of welcome to all in need, the poor, the sick, the aged, and the infirm, along with widows and orphans. As the needs of Toronto changed, the sisters had the foresight to open St. Michael's Hospital in 1892 and then St. Joseph's in 1921. And thus began our shared history.
Today we are a place of welcome for all in need, and that spirit of caring for the dear neighbor has transcended centuries. This picture of serving the needy at the door of the House of Providence, and the ones of a St. Michael's social worker sitting with a person in need, illustrates that the mission and values from the sisters are alive in the hearts of today's staff. The Sisters' legacy of compassion, innovation, courage, leadership, and responding to unmet needs continues in our hospitals today.
Together, we are the center of urban health care in Toronto.
Together, we are responding to the needs of people in our city and involving them in shaping the care they need.
Together, we will do everything possible through research, education, and the care our teams provide to keep more people healthy across our city and beyond.
Together, we will proudly move forward and carry forth the legacy of compassion, hope, and healing instilled in us by the Sisters of St. Joseph.